Talofa, my name is Suzanne Utai. I'm a mental health practitioner with over 25 years experience. I run a private practice. I work in the hospital emergency departments, and I serve with the Royal Flying Doctors providing fly-in, fly-out care. I was born in New Zealand to an Australian mum and a Samoan dad, and I'm proud to be a part of a blended family with 8 children. My passion is helping people navigate life's challenges and finding hope in the process. That's a little bit about me. Have an awesome day, and I hope to get to know you too. Hi, I'm Suzanne Utai. I've just come back on board today to talk to Tony in relation to mental health. So I'll let Tony introduce himself.
Hey everyone, my name is Tony Naea. I'm here in the beautiful, state of Victoria, Melbourne, and yeah, it's great to be on here. I currently work in the community engagement for one of the youth providers here in Victoria. So I enjoy what I do and love working in the community. So that's just a little bit about me for now.
Awesome. So tell me about, what does mental health mean to you? When we talk about mental health, what does that mean to you?
Talking about mental health, usually it's like the taboo thing because we don't really talk about mental health a lot. I mean, I'm old school. I think, going there, we're only 21 years old and very young. But I'm not going to tell you my age for somebody that might know already, but that's okay. But I've been brought up the old way, and the old way was, we don't talk about those things. It's not something that we're not allowed to talk about. I think growing up, it was just not there that we knew of much about. Mm. And so for me, when I hear mental health now, I understand it as maybe certain behaviors or certain struggles. There's the physical part, but there's the emotional side of things. In terms of the way we react to dealing with maybe stress, dealing with certain things like that.
Yeah. Have you seen it impact people's lives in the work you do, or in the family life, or the social life, or the church life? Have you seen impacts of mental health affecting
I have. And I'll draw from ground zero being me. I've seen it, how it's impacted me. As males, I think from us, we don't really talk a lot about things like this openly. Emotionally, we like to keep things to ourselves. We have that facade that we need to be tough and strong and so forth. But from my own experience, I've seen it, how it's affected me in my life. I have a disability. And I was very active in having the ability to lose my mobility at certain points. That really put me in a very, very deep, dark place. And I didn't realize that was what I was experiencing, mental health. And some would call it depression, some would call it, whatever they would call it. But I didn't understand that. I didn't understand it. I grew up with the mentality of, get over it, harden up, toughen up. That's the mentality that I had. When you deal with things like this, we'll be okay. Just a phase. Yeah,
and it is. I see a lot of people in my rooms and in session, and I guess maybe 10 years ago, I didn't see many Polynesians at all. It's changed over the next 10 years, but they always start out with, I'm not crazy, or I'm embarrassed, or my sister or my mum made me come, and they see it as a sign of weakness.
See, that's it's funny when you said that, right? Because that's how I was thinking as well. Like a lot of us do that.
Yes,
we feel like, I can't. I don't want to show people that I'm broken, or I have something wrong with me, that I can't deal with it. I could deal with it, and it is like people are afraid to show their vulnerability and weakness to deal with certain situations. But that's interesting you said that.
Why do you think that is? What is the challenge? Is it that I'm weak if I have mental health? Is it I'm going to embarrass my family? What do you think it is? What are the challenges that they...
That's a good question. I think, the whole stereotype around people who have the mental health, that they go see somebody because they need fixing, and that there's something wrong with them, right? So the idea that you go to try and get it addressed, it puts that perception of that person's seeing somebody because they're broken, and that kind of maybe encompasses that idea, well, that person's not all there, or is weak, or can't deal with what we're dealing with.
And isn't it funny, you before that you had a disability, but you're not afraid to go to a doctor to get the help you need with some of your physical, or even church, if you're spiritually broken, if you're feeling spiritually broken, sometimes you go to a bishop, some people go to a pastor, but they go to a spiritual advisor to get help. Yet when we're hurting in here, our emotions, we feel like we're supposed to just fix it ourselves.
Yeah, I totally agree. I totally how the way you explained it, it doesn't make sense that we're so easy to go see a doctor when we're sick, to go get some help. I think that there's probably a normality that we see. It's like, oh yeah, that's easy. I've got the cold, you've got the cold. Yeah, everybody gets it. And even with the spiritual things, same thing. But when it comes to mental health, I think I don't know. It's interesting that you say now there's more of our Pacific Island people coming to you, or you're seeing more now than before. My question would be, why is that now? That is it because we're talking about it more, which I feel is a good thing?
Yeah, I think part of it is we're talking about it, and I feel like, and I was telling someone the other day, I never saw Polynesians so I work in the emergency department of mental health, so I do mental health assessments, and I never used to see Polynesians coming into hospital because they were feeling depressed or sad or have those negative feelings. I would see them after they've attempted suicide. So we never saw that in between, when I'm feeling down and out and I'm not coping. I saw them when they had attempted. And I think that's we're talking about it more, and it's sad when you when our people, I talked to someone this morning and they were saying that their nephew suicided, and she got quite teary and she said, we didn't know. And as Polynesians, across the field, across the board, but especially Polynesians, that we're really good at hiding those kind of things.
Yeah, I definitely would agree. We're a village that we're proud of what we do. We're proud of who we are. Yeah. And, we raise up our voices when there's a massive celebration, and we don't lose really well. We're quite sore losers, but I think I can only imagine when things are hurting, it's probably even more devastating, people would hide from that. So it's interesting that you've kind of stated that fact that we don't really talk about it or come out because whatever reason that may be, but we can do everything else. But I'm glad that there are people. One of the things I'm worried about is that there are more of you Pacific Island people who are in these places, because I think that'd be the other thing, is we're finding that there are more skilled people who are like us, that maybe they're open to be able to talk to somebody who looks the same. Somewhat.
I agree. Quite a few of my clients that I see who are Pacifica have specifically sought out Pacifica because they get it. There's different. I remember one guy coming to me and he was saying he lived at home. He was 26 at the time. When he got paid, he gave 3/4 of his pay to his mum, and he was okay with that. Frustrated a little bit, but
that's our normal thing, right?
That's normal. And he said he went to a therapist, and the therapist said, "Well, you've got to set the record straight. You've got to say no. We're not doing that." And he goes, "Do you think I could say no to Mum? She'd clip me." And I laughed. And he was just saying, we just do things differently. So it's, how do we work around those things? How do we still keep our values? How do we still do the things that we feel we need to do, but do what we have to do for ourselves as well.
Yeah, I agree. I totally agree. So
Yeah.
I'm glad that we were talking about that, because I think it's a subject that I feel I'm working with one of the high schools at the moment, and there's a young girl that came up to me, and she was trying to raise this awareness. Her brother had passed and had committed suicide, and she's got this project. She put the proposal forward. The school wasn't listening to her, so I as an external stakeholder came in, and she kind of raised it to me. Now I've got some of the youth, the student council on board. The school's now taking attention to that and wanting to be part of it, and she's experienced it very closely to her family, and wanting to push that more. As a young Pacifica girl who had her brother pass, didn't understand what and why, and then her cousin passed.
And isn't that the hardest thing? I want to know why. And she'll probably find out why, So that's really hard for a lot of the young people. I was working in a lot of the schools, and, just talking about emotions, talking about suicide, those feelings, where a lot of our young people have those suicidal thoughts at times. And people feel suicidal because they feel stuck. They feel like there's no way out, there's no answer, and it's because of their maturity as well, and they're at a heightened state. They can't think outside the box, and that's why a lot of times we have professionals who can work through this with them and help them to understand and help them to find coping mechanisms to be able to cope when they're feeling really low or feeling those negative feelings that they have sometimes. I totally agree, and it's great that you are making this, bringing this awareness to us. It's you could talk to friends, you could talk to people, your parents, but having gone through somewhat my kind of struggles mental health wise, it wasn't until I actually had to sit down with somebody who was professionally, experienced, and it wasn't until then that I felt a little bit more at ease, that they understood, knowing certain answers that I didn't know or help me find those answers, and exploring certain ways. They just had everything about it. And I think that's a key too. So if we are able to do that. Yeah. And, we have family and things. I always talk about the scenario. You break your leg, my mum will tell me what to do and put it up and give me some medicine and do everything for me. But I still have to go to a doctor, a GP, to finalize it and fix it and help me to do what I do. And it's the same with mental health. Sometimes when we're feeling low or depressed, we can talk to our friends, talk to our family who are really comforting. And I think family is really important when we're feeling low. Being around the family is a good thing, but they're still not professionals to give you those techniques, strategies, help you work through what you're feeling and how you're feeling.
Absolutely. Totally agree with that. And I think that's one of the key things I've taken into this with this young lady, and wanting to start this project amongst the schools, was starting with her school and incorporating professionals. We're great as leaders, we're great as community leaders, but we're not professionals. We're not the professional people that they need, that knows how to deal with anxiety, knows how to deal with depression, knows how to deal with whatever abuse or challenges they may feel in their heads or wherever. So I totally agree with you.
Yeah. So do you think, so last month was Suicide Prevention Month.
Yeah.
This month we have Mental Health Day, Mental Health Week. Do you feel that is important to continue doing these things?
At the utmost. And I think if I hadn't gone through it, myself, and I always would say this to people, that people wouldn't understand it, and a lot of it is because they haven't experienced it themselves. But now that I have, I can understand where people are coming from, and it's just for me to do my part in this whole awareness of mental health is something we need to make sure we're okay about. Let's check your physical health, let's check your spiritual health, but let's also check in with our mental health. I definitely feel this is so important, and I love that this is what you're taking on, and that we can talk about it.
Yeah, and it's really interesting. I was saying, growing up, if I said to my dad, I'm feeling depressed, he'd say, go do the dishes. and then we don't talk about it again, and that's how a lot of us were brought up, and so we don't.
That's how we dealt with it, right?
Yes. So life is changing, and I think a lot of times I work with a lot of young people, a lot of teenagers in schools, and I think a lot of them, it's those emotions and feelings they don't know how to deal with sometimes, and it's really hard with a lot of them, that they're dealing with these emotions and feelings, but they don't know how to deal with them. And it's been so interesting, because sometimes I have people come into me because they're feeling anxious or depressed, and a lot of it is around relationships. And you look at, in today's society, when we were young, no phones, we'd go find our friend, we had one phone in the house that everyone knew, so you couldn't sit on there for hours or do anything. But in today's society, I had a boy tell me he had 439 friends, and I said, 439, and he pointed to the computer and he says he's got 439 friends. And I said to him, how many of those friends do you see face to face? And he said none. And so how do we deal with emotions and feelings when we're kind of shut off and isolated, and we're not able to express emotions and feelings? And I think a lot of our young people have talked to social media and are on that, and so they're missing out on a lot. We never had social media. If we wanted to talk to our friends, we'd go find them. If we wanted to ask them, we'd have to go find them. We couldn't just text or call a lot of the time.
No, there's no that Snapchat, the SMS, all that stuff that we didn't have any.
Life was different.
No, life was very different, and I think we were a lot more closer to one another, especially around our friends, our neighbors, our families that live within distance of walking, that we're able to have a conversation face to face, and talk to. There's some of these young people, they don't know how to socially interact, because you put them in front of each other, they don't know what to say sometimes. But online, they'll be like, wow, it's a conversation. But times have changed, and we need to kind of adapt to that and help our young people become more resilient, or just finding those opportunities to serve. But no, that's funny how you said that. I find that very interesting. The days have changed, and we need to as well. But I think one of the other things that you kind of mentioned earlier is the parents. We need to, as parents, to educate our parents. It's different. Like you said, some of these kids, that this is the first time they've had a broken heart. Going through in a relationship and not knowing how to deal with it. You compare a 50-year-old, or say a 30-year-old, to a 14-year-old who's just gone through the emotions of falling in love. It's completely different, where they're just first time trying to experience it, whereas us, we've probably gone through those many times, through 3 times before. But it's trying to help them, comfort them, counsel them, and guiding them, like you said, just directing them somehow, and helping them make those decisions for themselves.
So true.
I love that.
So
hopefully I've done some kind of good, but
we try, don't we?
Try.
So what message would you give to someone who was going through their own struggles, their own mental health issues? What advice or you share with them?
I would honestly just tell them, look, you're not alone, that there is help, that seek for that help, that talking to somebody or reaching out is not a sign of weakness. It's actually a sign of strength, because it takes a lot for somebody to reach out and to ask for help. So,
I think that's so important. You're not alone. And because a lot of people who think that they are the only one that's feeling the way they're feeling. And so you're right, they're not alone. And it is about reaching out, and it's a brave thing, it's a healthy thing to take care of your mental health. It's smart. Take care of your mental health now, so it doesn't build and build. And that's what happens. Sometimes it builds and builds and we explode, and then they go, oh my gosh, what's wrong with them? And it's not just what happened then, it's this whole build-up of things that have been happening.
No, I agree. So that would be my main message, is for them to know they're not alone. There's people there. Reach out. It's a sign of strength. And there's just keep hoping. Good days, bad days, we get through it.
Yes. All right. Thank you so much, Tony. I really appreciate your time. Thank you.
No worries. Thank you.